First, I just wanted to thank you, Myrna, for inviting me. It was really nice, and I'm really excited to be here because I know there's a lot of really good work that's done here in this area, so it's really nice to be here. Intellectual autobiography feels daunting, but easy enough to say. I did my undergraduate work at Cal State Long Beach, actually, in something completely different. I was a language literature major and kind of went into the workforce after that, and then actually went back to do my my speech pathology degree, my master's, after trying my hand at pre-med, and then realized I really liked CSD and speech pathology and rehabilitation. So I did my master's at Ohio State. And then from there I went to University of Texas at Austin and did my PhD after doing some clinical work, and my doctoral advisor there was Swathi Karan. And then after doing that, I went to University of Florida for a faculty position, and I've been there for about 3.5 years. In terms of my research, I'm really primarily interested in rehabilitation research for aphasia, sort of generally in the realm of lexical retrieval, which encompasses a lot, but also across a lot of contexts, mostly sentences, and now I'm sort of moving into discourse as well. And in addition, I'm very interested in bilingual aphasia and issues of bilingualism in CSD. So I've done some treatment work with Spanish-English bilingual specifically, and currently now I'm doing a lot of work with normal bilinguals and collecting some normative data on some existing tests and discourse measures and bilinguals to try to sort of fill a need there. And so the treatment I'm going to talk to you about today really started out as my dissertation, and I've continued it at Florida, and have started also working with it in bilingual folks, but I don't have data on that today, but I can tell you of an adaptation I made near the end that is kind of interesting, and give you a sense of where I think that's going. So I'm collecting data now. It's a little too early to say. So I think that's it. So today I'm going to talk primarily about verb network strengthening treatment, which is a treatment that, like I said, I sort of developed as my dissertation work. But as Myrna mentioned, that the talk that I did at INS was within a larger context of neuroplasticity. So I just want to sort of mention, this is a really wordy slide, but I just want to mention some basic principles of neuroplasticity that have been discussed. And if you haven't seen these two companion articles in JSLHR in 2008, they're really worth looking at. So two researchers, Klein and Jones, looked at or reviewed the animal literature and how it relates to rehabilitation and a lot of principles there. And then Raymer et al. Looked at that data and talked about how can we translate, or to what extent does it apply to aphasia, and that's sort of where we're going to jump off from. So really basically the neuroplasticity reflects neural changes such as dendritic growth, increased density, and more synapses essentially in the brain, and it's a part of normal learning, development, and a normal response to brain injury. However, the response, the changes in the brain can be adaptive and a good thing, or they can be maladaptive. So one of the things they found in the animal literature is where if there was a lesion, and these are rats, if there's a lesion and that animal starts using the arm around where that lesion was created in the motor area too soon, that there can actually be damage. It's so that there are neuroplastic changes in the brain, but it actually doesn't give positive results to the animal itself. So it comes into one principle we'll talk about briefly, which is timing of treatment. So that's one way that it can be translated. Improvement has been seen to be most extensive during the spontaneous period of recovery for rats. That's obviously very different than for humans. And for us, we talk usually about within 6 months or so. but it's not exclusive to that period. So as you all know, as researchers and clinicians, people can improve a lot during a more chronic phase. Also, the principle of use it or lose it, or as we oftentimes see as more of a learned non-use. So after not using an arm or a hand, or not even using the spoken modality for some period of time, people will actually lose that even impulse to do it, and that's one of the things that we can work on in therapy. Another thing that we all already probably knew is that repetition really matters, so that's an important principle that fell out of this. And also the richness of the environment, shared housing with non-injured animals, and the complexity of the rehab in terms of more skilled tasks versus non-skilled tasks really increase the neurological responses in the brain, but also increase behavioral abilities. And there's evidence of neuroplasticity and aphasia. We can't look into the brain except for maybe in imaging, indirectly, but we can't really look at the synaptic level or at the neural level. And so we usually gauge whether somebody's improving by their behavioral changes and then infer that there must be something going on at the level of the brain. But we do know that homologous areas, or areas around the lesion, perilesional areas around the lesion, or in similar areas on the other hemisphere, like what's analogous to, let's say, Broca's area in the right hemisphere, show some changes in responses in terms of people improving. So there's some of that evidence. So in that article, there's this nice chart that just gives a nice framework to start thinking about in terms of what are some of the independent variables with respect to treatment for aphasia. And some of them are timing, which I alluded to, how soon after the stroke or the TBI, the intensity of the treatment, the quantity of the treatment, the salience of the treatment, how relevant it is for the participant, what are the treatment variables, neural conditions, that would be things like the size of the lesion or where it is, and then there's the different components of language, as you can see there. And then some dependent variables are things we're very used to, the acquisition, generalization to untrained items or untrained tasks, interference, and that could be something that could be maladaptive, like semantic interference in terms of, as a result of semantic treatment or something like that. Maintenance of effects, and then neural effects, brain changes that perhaps maybe we can measure. So what I'm going to talk about today are salience with respect to the treatment items and treatment, and it's mostly at the lexical semantic level that I'll be talking about, and generalization is going to be a big part of what I talk about. I will also show you all the data in terms of the acquisition and the maintenance results, and we can talk about those as well. And then I've added at the bottom there participant variables, because that's just a huge independent variable, and the one that I'll primarily be talking about is severity of aphasia and lexical retrieval deficits today. So that'll be the primary, although there are lots of others. So when I first set out thinking about what I wanted to do for a treatment study, I had some really basic goals. And the first was to improve communicativeness via increased lexical retrieval and sentences produced by people with aphasia. What I mean by communicativeness is that the words are more specific than they might be using. So instead of he or she, that they're actually using the more specific words. So maybe it's a nurse or a dentist or a teacher or whatever it is. So increasing the specificity of the words used. And same with verbs. Instead of go, maybe they actually mean to fly or to drive or whatever it is. And also indirectly then hoping to increase their efficiency by increasing lexical retrieval. Also to maximize generalization to items that aren't trained and to tasks that aren't trained was a really big goal. And also to engage and challenge participants with salient and relevant treatment items and protocol. And also one that could be translated fairly easily out of a research lab into the clinic was also something I was interested in. So since we're talking about lexical retrieval, we all pretty much know, like, if we're going to name something that, and this is a very general schematic, that you recognize it, it goes through the semantic system, and features of that item are activated, such as its superordered category. It's a fruit, it's red, it grows on trees, and that sort of thing. And then it goes to the lexical level. And again, there's some assumed bidirectionality of this, and that's not what we're really going to talk about, but goes to the lexical level and off to the phoneme. So this is sort of the basic kind of component or setup. And then also there's something similar that goes on with writing as well. But there can be, as you all know, more intact speech than writing and vice versa. So there's some association. And I mention it because one of the participants, we did look at writing specifically. So just wanted you to keep that in mind. And we also know that there's treatment that's been done at the semantic level. And the one that's probably been talked about the most and that has some pretty robust results is semantic feature analysis. Okay, what happens here is it's primarily with nouns, and the participant is shown, I'd say participant or the client, is shown a picture, and they're asked to generate features of that, such as what I just mentioned, fruit, its usage, nutritious, you eat, some physical characteristics, where you find it, and then something personal. So it could be that they use it to make pies. Okay, and what the principle behind this is that other members of the category share some of these features. Okay, so if we think about an orange, it's also fruit, it's nutritious, you eat it, it has a skin, and you find it at a tree or a grocery store, right? So those features are shared. Associations might be different. And by activating those features in treatment, you're also activating the general features, and you're strengthening that category. Okay. So what we've seen from research then is that the activation of these shared categories results in spreading activation. So you can train apple and expect some improvement to the ability to retrieve orange. So that's generalization. That's why it's important, because you can't treat every fruit and every vegetable and everything, okay? So we also know that not all items in a category are created equally, which has been important in thinking about generalization as well. So if you think about a bird, a cardinal is a very prototypical kind of bird. It's what most people think about. It's small, it lives in trees, it builds a nest, it sings, it could come to your bird feeder. But then there are other birds, like one feeds at night, one is a scavenger. They're bigger, they're clearly different from the more prototypical bird. And then you can, but they both fly. But then you can even get more atypical for what you think of with a bird with penguin, and I guess that's an ostrich or an emu. But the idea there is that they don't fly, they live in different climates and so on. Okay, and so what you really have then is sort of a progression or continuum of atypicality or typicality. And so what the treatment, and so the principle of this was kind of shown on a computer modeling by Plout, and then it was applied to aphasia. And it was found that if you train the features of atypical items, you see generalization to intermediate and typical items. So this becomes very efficient. So it's counterintuitive. Most people would start with, what bird can people most relate to, and that's where you would start. But then you wouldn't see improvement to the larger category. And the principle here is that the features of the category are encompassed by the atypical items, but they also reflect the entire scope of the category by putting in the irregularities as well. Does that make sense? And so then training typical does not generalize then to atypical. And this was seen in aphasia with a Kieran and Thompson study. Okay. However, so the SFA results, semantic feature analysis, have shown consistent generalization, semantically related words, but generalization beyond that to sentences and connected speech hasn't been compelling or consistent. And the stimuli isn't always salient to the participants. Now, it doesn't mean as a clinician that you only have to work on birds or something like that, but still by limiting just to the single nouns, it's not always salient. Now, my treatment, verb network strengthening treatment, so verbs are going to come into it. There have been some treatments for verbs in terms of increasing verb retrieval. There's been a lot of treatments, and I'm not being exhaustive here by any stretch. But the idea here was just to treat verbs in a semantic way by asking, and these are a number of studies, things like asking questions related to the semantics of the verb, or even the phonology of the word, does it rhyme with things, and that sort of thing. And overall, these treatments haven't generalized beyond the treated items as a whole. There are also syntactic treatments out there for sentence production, and that's not at all my perspective. I'm just trying lexical retrieval, but they are certainly out there. Now, in the late 70s and 80s, though, there were, by Laverso and colleagues, there was these are not really easily found. Most of these articles are on the clinical aphasiology website that you can access, and so I don't think this treatment is widely known. But anyway, they did what's called Verb as core, and then they did cueing verbs treatment. So it was sort of a progress. And they proposed that the verb is the core of all simple sentences, and it specifies the relationships between concepts, sort of like within that sentence. And treatment tasks included generating, copying, writing, and repeating the doer and the receiver of an action. And that's just the person who does the action and the receiver of it. We'll talk a lot about that. And answering WH questions. And there was improvement on the pica and some generalization on untrained items as well. So it was a really promising line of research. And again, here, training nouns and verbs together with the verb as core was kind of a major component. Then more recently, there have been some priming studies that have looked more specifically at this relationship between verbs and their thematic roles. And so a thematic role is simply the person who does the action, the receiver of the action, which I'll show you, and some other things. And so these are priming studies. And what happened, there's a couple of them here, but encapsulated, people would see the verb that would flash, and then it would go away, and then they would see a noun. So, for example, they would see arrest, and then they would see policeman. And they'd have to make some decision about policeman, or they'd have to say it, or something like that. And what the researchers found, I have the citation, it's McRae and some other people, what the researchers found is that people react faster to the item that is a typical doer. So a policeman obviously is a typical person who arrests, than, let's say, a chef. Okay, so that's a priming effect if you're not familiar with priming studies. And so when people would see arrest or verb like arrest, it would prime policeman, but it would also prime a typical receiver of the action, such as a criminal. And it went the other way. It just wasn't verb outward. So a nun, for example, would prime prey, okay? And it can go this way too, so that dice would prime roll as well. And so this has been seen in young adults, and we just replicated it in young adults and have seen it in older adults as well. So then also what's really super interesting, and there's a lot of therapeutic possibilities for, are instruments. So things like slice and a knife. So whatever you use to perform an action is the instrument of that action. So it could be knife for slice or scissors and cut, and you can go on from there. And that was bidirectional as well, the priming. And location primed a typical action that occurred there, like arena and skate, but not in the other direction. So this really sets up a lot of nice possibilities for treatment, and was really integral in kind of putting this therapy together. So what are the implications? Well, thematic role assignment involves really experiential knowledge that's specific to the events denoted by the verbs. In other words, a verb such as arrest, for example, really actually activates kind of an event memory. Even if you haven't seen one, you have sort of this idea of what the schema is about it, right? So if there's an arrest, there's the policeman, there's a criminal, there's probably handcuffs, and so on and so forth, right? So it's not just that these are sort of semantically related. There's experiential knowledge that's involved. And so that's what I mean by that. And these thematic role concepts then are not formed from a limited set of just features that are just happen to be part of the verb, but through everyday experience with the objects involved. And in a way, then, thematic roles can be seen as features of a verb itself, if you can kind of think of it that way. And I'll give you an example in a second. And also, one verb can have a multitude of related thematic roles, potentially representing a large network of these schemas, the activation of these sort of mini-event and semantic relationships. So let me give you an example. So if we take a verb like measure, you're going to see this a lot. And a carpenter can measure lumber, right? And that sort of evokes one kind of a concept. But a chef can measure sugar, which is very different. A designer can measure fabric. A surveyor can measure land. Okay, so there's lots of possibilities around this verb that evoke different things and different sort of semantic possibilities. Now, in the same way that apple was semantically related to orange and improved retrieval of orange, verbs also sort of have these semantic relationships. So one that's logically associated with measure is weigh. Okay, and so then it has sort of its own network of thematic roles. So a butcher can weigh meat, a cashier can weigh produce, a nurse can weigh a patient, a jeweler can weigh gold. If you do this enough, you can just, there are just infinite possibilities. You'd be amazed at how much there really is around these sort of things. So the idea then would be to try to train this network to see if you can get improvement of lexical retrieval of those types of items, but also to semantically related verbs and those networks. So if you think about it then in more of a pictorial way, there's a lot of possibilities. So here, some of this is what I mentioned. So just from this one verb, you get a carpenter, and he could measure a window or lumber. You have a chef and all the things that he could measure, a designer with fabric, a mannequin, a surveyor, and then I have an auto mechanic there. That's a nod to one of the participants, can measure a car. But then if you add on to that the instruments that are used to measure. So there's measuring cups and spoons and rulers and yardsticks. There's a lot more, and then also all the different locations that you could possibly measure. So a huge semantic network that you're activating, potentially starting with one verb, which is in contrast to the semantic feature analysis, which really just limits you to the features around one specific noun. So then if we're to, I'm just reminding you then, so that it's lexical retrieval we're sort of after here, but I'm saying that I want them to improve in a sentence context. That's my goal, not just single words, although we do measure it, and for some of the more severe folks I'll talk about, it becomes a really important measure of improvement. However, so without, this is just sentence production model to give you a sense of at least conceptually how then I think about this. So if we have the target sentence that somebody just happens to want to say that carpenter is measuring stairs, okay, which is one of our probe items. The idea then is when it gets to the functional level, or if you even want to think of it sort of like the semantic level, there are the target content words, which are the nouns and verbs that get activated when you have that message that you want to say. But there are also competitors. So there could be these semantic competitors like plumber and weigh and wall, let's say. And there might be other noise in the system because someone has aphasia and there's other things going on. So the idea then of this therapy is to increase the chance that the target words that they want to say are the most highly activated. Okay, so in principle, that's what I'm trying to do. Okay, so now to the studies. Are there questions about the background before I go into the studies? Everyone gets it? Okay. So this is just a reminder of what the goals were originally. These are the dependent variables that were probes, and I'll tell you more about the design in a second. But these weren't seen in treatment. But you get the idea there of a carpenter measuring stairs, a nurse weighing the baby, and that sort of thing. So the goal is to get them to be able to see if they can generalize the treatment to being able to produce sentences around these types of pictures. Okay. And as a reminder, here's the theoretical framework, and the question then is, what is the treatment protocol to increase the activation of this network? And that's what I'm going to tell you now. So this shows you our participant is down here, and the clinician is up here. I probably should differentiate them. But this is really, really low tech. Index cards work. You can cut them into thirds the short way. We also have used laminated strips and things like that with dry erase, but actually the index cards work just fine. And the clinician simply puts down a who and a what card and the verb, and says, I want you to tell me who measures things. Who can measure something? And there is a cueing hierarchy involved here, because of course at first they're not necessarily going to be able to think of something, and personal responses are absolutely encouraged. So it might be their wife that measures something, and we start there, but then we do suggest some other options. But just to give you an idea then, so here's the list that you've already sort of seen. So let's say this list gets generated with cues that are appropriate, and then that get faded out. And then here's the personal one. Now what you've done is you've created a situation of constraint, which is helpful. So now we ask them, well, what does a surveyor measure? Okay, so now you've limited the possibilities, and so then you're matching the list basically. So essentially what you're doing is that network I showed you, you're just trying to strengthen that by retrieval of all these items around measure. Okay, and so then they choose a pair, and this gets changed every time they see the word, and they're asked WH questions. And they don't have to use a full sentence to respond. It's really just for them to think about the concepts a little further. So when does a chef measure sugar?
So can I just ask, so
sure.
Just so I'm sure about the point of this, so the types of patients are those whom you know understand the individual lexical items. It's the combination of those lexical items into larger structures that is the problem, right?
Yeah, so, well, as I'll show you, I have done this with people with non-fluent aphasia and with fluent, and the fluent folks, their comprehension wasn't as good. But by and large, they understand the concepts for the most part. If they have some trouble understanding it, we don't usually really define. We use these actual lexical items to reinforce the concept. So the concept of measure gets really strengthened when you give a really typical example of it. So you can actually show them, well, you know, if you use, you know, sort of a tape measure and you have a carpenter and a lumber, and it pulls it together for them. But absolutely, they have to have adequate comprehension to be able to do it. But at the same time, there are adaptations I think you could make for folks. Now, these WH questions were more difficult for some participants to understand. So we wouldn't just say when. We would say, you know, what, you know, is there a certain day, a certain season, you know, the kind of cues you would give. But we always accompanied it with when, and their WH comprehension improved a lot as a result of that. And that's just a great byproduct. So you might ask when it happens, and they might say before dinner. Why does it happen for the correct amount, and where does it happen in the kitchen? And of course, again, they can get assistance for this at first if they need it. And in the clinic, you can have a lot of flexibility around it. Then another step they do that I don't have illustrated here is there are sentences that I put together ahead of time. Now, I think this step could be optional, to be honest with you, unless you have somebody with more severe comprehension problems. And that is where they would hear a sentence that's correct semantically. So it might be, you know, a chef measures butter. But they might hear a sentence where the patient is incorrect semantically. So it might be a chef measures books. Okay, so it's grammatically just fine, but semantically it's not. And they just have to make a judgment. Does that make sense or does it not? And then another case where the agent is inappropriate, and then where they're actually reversed. So we might do the butter measures the chef. Okay. But most of the participants have done really, really well at that. So if time is an issue, I think that's really optional. And so then we just ask them one more time to generate these two lists without any cues at all to give them one more chance at retrieval. So we might say, okay, tell me again who can who can measure and so on. So then to decide when to end treatment, did you have a question?
When you're at that step of generating, are they generating linear or vertical?
You know, I let it go for however it works for them. I initially had it with a set protocol, but they naturally fall out into starting to pair them up. So we don't want to stop them from doing that. So if they just do, you know, one, then we would prompt them for the pair. But I tried to keep to a set protocol, but what you ended up doing was saying, no, wait, not yet, and yeah. So it can go either way, but they naturally just start to pair them up. And they're not always the same ones that you worked on, and we tell them that. It doesn't have to, because I don't want it to be a memory task. So we let them know you don't have to use the same ones we just used, but can you think of any? And so the treatment is criterion. It's ended based on criterion rather than preset amount of weeks. And so what we do is there's 10 treatment items, 10 different verbs, and I'll show you those in a second. And when they can get 80%, in other words, there's 10 verbs, 3 possible pairs I've decided, so it's 30 pairs of words that they could retrieve in a week, right? Pairs meaning making sure the agent and the patient are appropriate. And when they can get to 80% or 24 pairs a week, then that would be reaching criteria. That was for the first study, but now I've extended it to being able to do that at least 2 weeks in a row. But anyway, that just gives you an idea. So here are the verbs. I know Myrna mentioned that the concept of the different kinds of verbs was interesting, and the jumping off point from this is just endless and what you could do for different types of verbs. But anyway, here was the general criteria. This was like 4 months to come up with these like 12 pairs of verbs. But here was the criteria. The first, that it had to be transitive. In other words, it had to have a receiver. So you bake something or you drive something. Okay, so that was the first criterion. Yeah, the minimum was just that there had to be a receiver. That was it. Some other things I just couldn't control for. And also that there was that they were in the same semantic category according to this book by Levin, but also we did semantic relatedness ratings. So on a scale of 1 to 7, we had young normals rate these in terms of how semantically related or how similar did they think that they were. And some of them are a little low, and I mean, I'm happy to tell you which items I think are more problematic than others, having used them. But for the most part, they're pretty high and have worked out pretty good. And then frequency, imageability, and those things were balanced for the two sets. And when I say semantic weight, I didn't want more of general verbs. So I didn't want something like make, because that's a very general verb. The idea is we want to increase their semantic specificity. So instead of make, you might have sew and knit. Okay, the one wash sort of slipped in there, and that's more of a general verb. But that's generally the idea of how the verbs were created. The experimental design for this first study then is there were 4 participants, and participants 1 and 3 were trained on verb set 1, and participants 2 and 4 on verb set 2, and we're of course looking for generalization or improvement to pictures representing the untrained semantically related verbs. Treatment was twice a week for 2 hours each. The probes were always done at the beginning of treatment, usually on the second day that they came. So that wasn't exactly 4 full hours of treatment because of the probes. And in this study, generalization was considered to be 40 percentage points over the highest baseline point. But I've since modified that, but I'll show you. So here are the...
Is there a reason you picked 4 hours?
It's just kind of what we were standardly doing, to be honest with you. Twice a week seemed a reasonable thing for clinical purposes, but 1 hour just isn't enough. So there wasn't a lot of thought other than it just worked, and it seemed to be sufficient in terms of time. So there were the 4 participants. You can see 3 female, 1 male, their ages. Education was 10 to 16 years, a variety of professions, and all had a single left MCA, and all were at least 10 months post-onset. Participant 1 and 2 were non-fluent. Participant 3 and 4 were fluent, and you can see that their WOB scores, they were all sort of in the moderate range, all in the 70s. And here I have their BNT scores. This is percentage. So here's the fluent and non-fluent. And then I thought I had I guess it didn't show up there. The NVPB is not a published test. It's the Northwestern Verb Production Battery. And it's Cindy Thompson's test. I don't think it's currently published. But at any rate, this was just single word verb naming. And then the apraxia was mild to moderate for the non-fluent folks. So then they got the treatment in the way that I described to you, the protocol, and then each week the probe was giving them all of these pictures, trained and untrained, mixed up, and the cue was make a sentence and include, and we would point him, the action, and this. Okay, so we would point to the things, and we would say that each time as repetitive as it sounds. So we wanted to make sure that they knew. The only cues that were given were we would ask for a more specific response if they gave a general response. So if they said the man, then we would say, is there a more specific thing that you could call him? And then that would be it. So those were the cues that were given. Once they really got that, we didn't tell them every time because that got to be too much. And then also to determine if the response was correct, this was a very conservative, I'm realizing now, criteria. Every word had to be correct and it had to be specific. So they couldn't say the man is measuring the stairs. That would just be wrong. Now it doesn't mean that we didn't look at the responses, but just for the purposes of the probes and the single subject design, that's considered correct. And participants were allowed one phoneme off for each word. And that's true also, just so you know, for any of the naming tasks. So I allow them one phoneme off. And some other people have done that. But it seems like it's a way to allow for capturing maybe some improvement if they go, to as far as being able to get it with one phoneme off, to give them credit for that.
And grammatical errors?
Didn't matter. Syntax didn't matter. They could put it in any order. They happened to put it in the correct order. But again, it was something we looked at, but it was all about word retrieval. Okay. So if they said carpenter measures stairs, it was fine. Yep.
Just
yeah.
To be clear in my mind
yeah.
about the procedure. So on every week they're coming in and they're doing this task where they're said, tell me who measures what, and they generate a bunch of things, and then they also get these pictures where they have to produce the specific description?
Not exactly. This isn't part of treatment at all. This is a measure of generalization of treatment. So let's say they come in on Tuesday and they're there for 2 hours. They're just going to do that treatment with the cards. Just cards. As a matter of fact, we never even gave them a combination that was the same as any of these. So we never helped them to generate, for example, the nurse weighs the baby. So it was just the cards. Then they would come in on Thursday, and before any treatment, they would see these pictures. So it would be 20 pictures. And they would be randomly and say, just make a sentence for this, and there was no feedback. So that's the way then we can say, is it generalizing to something untrained? And that's the data I'm going to show you. So I'm glad you asked, because otherwise the data would be really confusing. And then after they did the probe, then they would go and finish treatment for the rest of those 2 hours. And for these folks, we could get through the 10 items in a week once they got the task. For the more severe folks that I'll talk about, that wasn't as possible.
The cards had the printed words on them. They were not pictures, right?
No, there's no pictures. It's just
like their reading comprehension.
we just helped them if they didn't know how to read the word. So we didn't give it to them. We asked them to generate. So an example, like let's say I'm not supposed to move. Let's say the first time they come in, we give them that measure thing, and we say like, who measures something? And then we would say, do you know what we mean by measure? And usually they would say yes or no, but then you kind of know from their responses as you go if that's true. And then they might say, well, me or my sister or something like that. A lot of times it would be personal. And we would follow that through logically and say, okay, well, if it's your sister, what is it that they measure? And finish it out. And then they would usually kind of maybe be stuck.
So, Lizzie, you would write it down? Is that the point?
Yeah, you just write it on the card and set it there. Now, I was prepared, though, because I knew that we were going to need to give them something if they couldn't get anything, because we don't want to just sit there and, just come up with something without any structure and just struggle. So when they were tapped out, it could be after one item, it could be after 2 items, they're stuck. Then I would have these cards pre-prepared. So I already thought through, well, who are different people that can measure things, and what are the things that can be measured? And I tried to have diversity around those items. And so what I would do is say, okay, I'm going to give you some cards. And they do this in semantic feature analysis. It's the exact same thing, where they give cards of features, and you decide, okay, an apple is a fruit. Yes, it is not a vegetable. I reject that. So you're using your knowledge of what an apple is to do that. In the same way, they're using what it means to measure to decide, policeman measure. Well, not really for their job. I'm going to reject that one. And if they can't read it, we just read it for them. Okay, here we have policeman. Does a policeman measure things? And then if it's yes, it goes up in that column, or in that case, no, and so on. Yeah, so that's what happens. So the cards are pre-done for that purpose. And so I just use a little file box with little tabs with each verb, and I had them paper clipped for agents and patients, and then I had a group of foils that I would just grab that weren't related, and I would mix it in. So there were 3 foils in each case. So it causes them to have to think through it. So if they can't read them, but by the end of treatment, they were all reading them flawlessly. So it did help their single word reading comprehension. And we did do the reading portion on the WOB just to make sure that they didn't have any really huge reading deficits. But I think we could have gotten around it if we needed to. So yeah, so that was the treatment, and then here's the dependent variable, the outcome, to see if they're at all improving. So here's participant 1. This is my only video, but so let me orient you to this. This is single subject design, so I have data for each participant. And over here is the % accuracy. So remember, if they get 1 dot, that means they got all 3 words correct. Okay, and before treatment, the red is the trained, I'd say trained verbs, but it's going to be the entire sentence they have to produce, and then also the untrained are in the round circle. Okay, and we did 2 baselines, and then we started treatment, and he had 4 weeks of treatment, and so he was at 80% for the trained items and 90% for the untrained items. And I didn't mention the adjective control task, which I will now. And then the maintenance is 1 month after treatment. Okay, so these are the pictures with untrained items and trained items. So there's a couple patterns. Oh, I have arrows. There's a couple patterns that you're going to kind of notice. One is that, and this isn't in the manuscript that we wrote up, but it's something I've been thinking about. The untrained items are going to be better on most of these folks. And in the maintenance here, you see that that's true. The other thing is that this was too short. 4 weeks was just too short. I really should have gone. He hit the criteria, and I had already said it, so I went ahead and stopped. But I would have gone maybe even if it had to be just 2 more weeks, and I think maintenance would have been a little better. However, and I won't belabor all of these, I just want you to get oriented to this. These items reflect still very well made sentences. Usually what was wrong is there was a semantic error of a verb or something like that, and I did go back and look at that. So the quality of these sentences that were wrong was entirely different from these sentences. There was probably just 1 little error. And that's the problem with having such a conservative measure of having all 3 words be considered to be correct, and I've changed that since. The adjective control task, so there was a control task, and it was virtually impossible to come up with verbs that I could match to these trained items that wouldn't theoretically improve as a result of the treatment. By the time you match them for everything, and especially that they're imageable. So that was the other difficulty. You have to have verbs that you can create pictures around. I wasn't getting a good set. So we decided to go with adjectives, which are also content words, and a task that was theoretically easier to be more on the conservative side. So what would happen here is it was a sentence completion task, and all the items, I don't have all the data, I'm sorry, all the items were matched for the verbs. But it was basically something like someone who is ill is also said to be, and then they would have to say sick or something like that. And there were examples, and we made sure they understood the task. And in fact, you can see that they did understand the task because he was at 50% when we started, but there was no improvement on that task. So that's at least presently what was used. So this is my 1 video of participant 1. I've been assured this won't get on the video. So the first thing that he's going to try to say is the farmer is towing the trailer. And I have pulling and horse here because those were responses people ended up using, and they were correct, so we took them because there's a horse in the trailer. And then he's going to try the nurse is weighing the baby. Okay, and then that's pre-treatment, and then this is, I think, maybe his last probe or something.
Okay, him, the action, and this.
She is having he is giving me the
All right, now what's doing? So you're going to talk about her, the action, and this.
She is having a baby. Having a baby. She is no.
That's fine. We'll just go with that.
Okay, so as you notice, the verbs aren't specific, so having and getting, but he was using verbs, which was great, and he used he and she instead of farmer and nurse, but he did get baby. Everyone gets baby. Everybody gets baby. Oh, I don't want that to happen. Let's see if I just play the other one. Now this is post-treatment. I do think the order of these is reversed. So I think the first thing he's going to do is the nurse is weighing the baby. You have to listen because it goes quickly. So.
The nurse
Wait, I don't know why it's not showing up. How do I get rid of this? Well, this one, okay, there we go. There we go. Okay. And then I think I need to do this again. There we go. So I think, like I said, he's going to start with the nurse is weighing the baby.
The nurse weighs the baby.
Him, the action, and this.
The farmer is driving the truck and pulling the trailer.
Okay.
So we got we got a bonus verb there. Yeah. So
Him, the action,
nurse
this.
weighs the baby.
not sure what works. Okay, there we go. So I'll be honest, he improved more than I thought that he would. So a lot of improvement as his probes reflect. We'll look at his pre and post data too. So that's participant 1. So I'll go more quickly through the others. I just wanted to get you oriented. So participant 2 is also non-fluent. Red is trained, blue is untrained. And so here you see the trained, and then the blue is the untrained, and then this is 1 month maintenance, and there's the adjective control task. I do have some examples. So here's the target, gives you some idea of what some of the sentences are. This is deemed a bad sentence by me now because soccer player is 2 words, and it just doesn't, it's more difficult. But at any rate, the soccer player is kicking the ball. Pre-treatment, soccer player and the ball are going to be in the court, and then after the soccer player is kicking the ball. So that's participant 2. And then participant 3 was fluent. The target here is the landscaper or gardener was fine, is pushing the lawnmower. The man who takes care of the plants is using the tearing, cleaning, the rinning, the thing he takes to cut the grass. And then the landscaper is pushing the lawnmower. What was interesting about her, I know you guys are clinicians, so I'm going to give you the interesting tidbits. So here's the trained items. Again, you see that they're lower than the untrained items. But after a month of maintenance, or a month without treatment, she improved. And so I went back and looked, and the errors on the reason she wasn't improving here is she was getting semantic interference, or what she was making semantic errors. So instead of she would say drive, watch, she would say listen, deliver, give, that sort of thing. And then those sort of resolved themselves after that month off. So that was kind of interesting. So that's participant 3. And then participant 4 was the most severely impaired. And this, I chose this one because it was one of her more succinct responses, but a lot of them, there was a lot of circumlocution. So here, the policeman or the officer is writing a ticket. Here, he's a ticket for me, my car. So we don't really have a verb here. And then this officer is writing a ticket for the car. And she had to leave. She was from out of town, so we could not do maintenance data on her. But I do have her pre and post results. She did, however, meet the criteria for generalization, which was 40 percentage points over the baseline. But I would have liked to have gone on with her. Excuse me. So since one of the principles, so that's the generalization aspect of things. So we trained one set of verbs and got generalization in sentence production on another set of verbs. But also one of the things we were going to talk about is the saliency of the item. So I just chose some some to show you what they were producing. So the first guy was a body mechanic, and so, for example, body mechanic measure bumper I told you about. But without exaggeration, he came up with a response about being a mechanic or about cars, or sometimes racing, because it was really what his passion for every verb. And when we got to knit, I thought, there's no way. It turns out his ex-wife knit Afghans was one of his examples. He had lots. And he actually had knit a car to put over a Kleenex box. So he was 10 for 10. So it was really, really interesting. You would just never have any idea talking to him that he was knitting ever. So participant 2, these are some of hers. She had at some point worked as some form of a receptionist or something, so she talked about executives writing memos, daughter baked beans, and her fisherman, who was a friend, scrubbed a boat. Participant 3 and her husband were avid bird watchers, so they would talk about watching birds. She also talked a lot about tennis as well. A child shakes a present, so again, things you wouldn't maybe think about for verbs like shake. And again, travelers scrub their motorhome, and again, that was related to her. Now, participant 4 was a professional musician. And so she played the banjo and she sang, and so you can imagine that her aphasia was a huge part of her work and having trouble going back to work. And her husband was in the band with her. So my favorite, I think, of all the participants I've done is that she said a musician, or she was referring to herself, chops a banjo. And this was after a couple weeks of therapy. And I said, really? Now I want you, and this is what the typical thing, think about what it means to chop. Do we really chop a banjo? And she said, yes, chop a banjo. Chop a banjo. And she was sure of it. So I said, okay, we'll go with that. And then afterwards, I talked to her husband, who was watching, and he had tears in his eyes, because it's a technique on the banjo, apparently, to chop banjo. I didn't know this. But he was so thrilled because she hadn't said anything about that. And so I think that's one of my favorite, because, again, you just don't know where some of these verbs will take you. Her sister was redecorating or something, so she talked a lot about her measuring different things in the house. And also read now. Her husband reads music, and audience watching. She loved rodeo and not bullfighting, but bull riding, that kind of thing, rodeos, yeah. So that was something she talked about a lot. And then remember, all of these could have those WH questions. So you could ask about the rodeo. Well, where does that happen? When does that happen? Why does it happen? So these can all be expanded in the treatment. So then their pre-post results, I'll go through these quickly, but the WOB for participant 1 improved, something like 6 points or whatever. The BNT went up about 10 percentage points. Single word naming on verbs went up, about 14 points or whatever. But what I didn't mention earlier was that the Northwestern verb production battery also has a sentence component. And what it is it has one place, so there's no receiver of the action, sort of like the dog is barking. 2 place, I can't think of one right now. Driving a car, let's say the man is driving the car. And then 3 place, the girl is giving a present to the man, kind of thing. And overall, the items aren't as semantically rich as the probes, so a lot of the subjects could be man or girl or boy, so that was reduced a little bit, although the verbs were specific. But there were some specific things too. And the reason I mention that is, we gave them the sentence without any access to the verbs, which is different from the protocol. And there was a lot of improvement on their sentence production on this test, which I was really happy about, because they weren't specifically related to the treatment. There's a few items that are the same as treatment items, and those were taken out for this. So that's participant 1 improved into the 90s. Participant 2, again, showed improvement on the WOB, single word naming of verbs, but not on nouns, on the BNT, and also the sentences improved a lot. Participant 3, some improvement on the WOB, nice improvement on the BNT. The fluent folks improved a lot on the BNT, you can see with the nouns, especially participant 4. So participant 4, who was sort of most impaired to begin with, really really surprised me with some of this, and then also the sentences was great, but didn't improve on single verb naming.
What about the quality of the errors? Do they tend to name if they're getting they're giving an incorrect response for verb naming? Only what is it? Just they don't know, or they know the
No,
object and the
we
picture?
did do an error analysis. It's real sort of brief that I wrote up, but I have more detailed data on the newer folks. But it was an evolution of processing, I would say. So instead of I don't know, it was more likely going to be a semantic error, or maybe for the fluent folks, more of a phonemic error. But they were much closer to the target, and there were very few I don't knows anymore.
And they were
by the end of the
treatment class errors. They were saying verbs, not nouns like an object affected by the verb.
There, I'm trying to think. Initially, there were some going to verbs, or verbs going to nouns, but very rarely. I have actual data for the second set of folks that I have that I can show you. But I do classify them that way as same grammatical class or different, and they were primarily within the same grammatical class. But if it went one way, it was always verbs going to nouns. And a lot of those verb errors, actually, and I'm going to mention that more with the severe folks, is the use of the instrument, which I see them replacing the verb with the instrument. So they'll say, you know, the butcher knife ham or something. So they use the instrument as the verb, but not in a way that we use it like hammer. So it's really interesting. So that would be, if it were single word naming, that would be considered other grammatical class. But you totally see that error. Yeah, it's really, really cool.
Was perseveration a problem for any of these folks ever, or?
Nope, not with these folks. Not perseveration. Participant 4 was circumlocution. Yeah, but she did get much more. I was very surprised doing the BNT with her. I remember second time, I was just sitting there thinking, don't make a face, don't do anything, because she really had, her access to the items was really noticeably better. But with these folks, no, not perseveration. Okay, and then the last thing, I did look at connected speech. Now, this was a real sort of kind of traditional approach at this. So I used the wob picture, the cookie picture, and the Cinderella story. And I know you guys know all this stuff. I've changed some of this since. And here's the results. Let me tell you what the measure was. So here's participant 1 through 4. And I'm not going to talk about their number of utterances and MLUs and all that kind of stuff. I mean, you could really analyze this for lots of things. What I did is, I didn't really create a measure, but the measure we decided on was I wanted to see what their retrieval was like within utterances, because my goal was to improve their lexical retrieval within an utterance. So I didn't want to do, content information units for this analysis, because it might show that they use more content words, but are they producing more utterances that are complete and relevant? That's what I wanted to know in this case. So what we did was code was the word, everything was transcribed. I have an example here, but I don't have the coding. But everything was transcribed and put into utterances, and then we would go through, and this is outlined, I mean, this has been written up, but it had to have a subject, a complete subject and verb, or complete subject, verb, and object. But we did not penalize if there were some grammatical errors or morphological errors or that sort of thing. Is there a subject, verb, and when needed, an object? And are they relevant to the picture? That was the criteria for each utterance. So we would go through and count the utterances and how many of those utterances were complete and relevant. So that was the measure. So here, percentage of the relevant utterances that had the SVU construct. That's what this is. So this is before and after treatment with participant 1, 2, and 3, and they all improved noticeably. Participant 4 didn't improve at all. What was interesting about her when I went back and looked at her is she actually, I think, got less efficient She used more utterances and really wasn't able to put these together. And her sentence construction, the problems were really sort of deep. She just had so much trouble putting an utterance together. So the treatment improved when she was constrained to those SVOs, and her single word naming improved, her WOB score improved, her comprehension improved a lot. And I'm going to talk a little bit about functional improvement, but her husband noticed almost immediately her comprehension improved. So she improved a lot, but it didn't translate, at least on these measures, to conversation or to connected speech. So this is really too little to kind of look at. If I can show you later if you want. But this was an example of participant 3 in her pre-treatment and then her post-treatment. And it really did become quite nice. You know, mother and 2 of her children were in the kitchen. The children were not looking at mother. They were trying to find some cookies. The girl was standing on the floor, and so on and so forth. So I was also really pleasantly surprised by this as well. So that was good.
So also the information being conveyed is much richer. Right?
Yeah.
So you can look at information units as well as...
Yeah, it could go back and really be analyzed in a number of different ways. I just wanted to answer, at least for this, that one question. But yeah, I think it does become richer, and you see less, not that she had tons, but less sort of struggle to retrieve words. And I don't have pause times and everything in there, so this is just to give you a sense of the content. And she clearly said more. Okay. So this is just to tie it up real quick for you because I know it's tons of data. So the sentences, the dependent variables of those sentences with Carpenter and all of that, there was generalization in all the participants. On the single word naming of nouns and verbs, 3 of the 4 participants improved at least 10%. On the sentence production, all participants improved 15% or more. And that was, again, about participant 4 who didn't do well in the connected speech. She did translate to other sentences, but again, it had to be constrained, I think, for her at that time. And on the connected speech, 3 of the 4 participants improved, and there weren't any appreciable gains on the adjective control task. So that's the first study, which is by far the longest. So are there any questions? Because I can just continue real quick. Okay. So then I was interested in, well, what about more, how far can we push this, right? So clearly, or not clearly, but at least from these 4 participants, we can gather that people who are at least, have a moderate aphasia might really benefit from this approach. And it's not that I didn't want to pursue this, but when I went to Florida, it just so happened the people that I first encountered had more severe problems with lexical retrieval and aphasia, so we thought, what the heck, let's try it, right, and see how it goes. Now, I did make some minor modifications, and I'll let you know as we go. And I wanted to do it partly because a lot of times when people have more severe impairments, we tend to stick to the single words or making it so functional that you're not thinking, how could we branch out maybe a little bit beyond that? And maybe push it to see, could we get sentences? So that was the thought behind it. So they were both women. They were both young, in their 40s. Education, they're 6 and 2. Participant 1 was a computer programmer, and participant 2 was choreographer. And you can see there they both had left CVAs, although participant 2 did have a right CVA when she was in the hospital with her first CVA, but there were no appreciable problems on our behavioral testing, so we just went ahead and took her because she just seemed great. And so participant 1 was 4 years post-onset, and participant 2 was 9 months. So participant 1 had gone through rehab and therapy and then had just sort of stopped and was living independently with her mom nearby, but decided she had some goals that she wanted to achieve, and she wanted to get back into speech therapy. So that's how she came. And then participant 2 had gone through sort of the rehab process, but wanted to do some more with her speech, and lived with her folks at the time. Okay, so here's sort of where they were. Their WOB scores 45 and 36, BNT percentage. You can see participant 2 is more impaired than participant 1. I have the BNT here, but really primarily I'm interested now in the object and action naming battery, and I don't know if you're familiar with this. It was developed in England. If you are, then I bet I can mention. There's a total of 162 nouns and 100 verbs, but it's broken up into list A and list B, so you can use one list or the other. So I wasn't going to put them through all that, so they got one list, 81 nouns and 50 verbs. And then also, this is just the updated version of that Northwestern sentence test that I already told you about. So we had 22 and 0%. But participant 2, as you'll notice, so here you see her object and action naming is 16 and 12%, but here it is in the written modality, 77 and 66%. And so there was a huge difference. So we went with that, and I'll tell you what we did in treatment. And this is just by comparison. These were the participants in study 1, so you can see that they're very different sort of with respect to severity. So the probes were the exact same, but we had to modify the scoring for the probes. I mean, there was just no way you could say all 3 words had to be correct. It wasn't going to be reasonable. I really wanted to be able to capture improvement in lexical retrieval if it was approaching the target in a reasonable way. Okay, so what we did is each word now is scored. Okay, you can go back and look at how many complete sentences were there, but each word is scored for the probe. So now instead of a y-axis with 10 sentences, you have 30 words that are possible. And so they would get, if there was no problems, obviously they get 1 point for each, so they could get 3 points for a sentence. They were allowed 1 phoneme off, just like the original study. So carpenter, measure stairs would be a 3. If they had 2 phonemes off, I decided to go ahead and let them do this. So if they said Chet bake cookies, they would get a half a point. And the chauffeur driving the limousine, I gave a half a point for semantic errors, because again, if they're moving toward from man or he to pilot, I think we're getting closer to the target. And we did reliability on this scoring, though, to be sure. And so, but with the non-fluent folks, it's much easier. It's with the fluent folks that the reliability is a lot harder. If they said man or woman or boy and it was appropriate, they got a quarter of a point, but they did not get anything for pronouns or clearly, words that were more than 2 phonemes off. So this gives you a sense of our scoring method. Okay, so here's participant 1. Now, one thing I didn't mention is in the original treatment, there's not, and this is something I need to change. There's not a lot of retrieval of the verbs. Okay. There is one step I forgot to mention. So after they generate those pairs, they do actually go through and they would read the pairs. So in the original study, they would do like carpenter, lumber, surveyor, land, but they didn't include the verb, because I was trying to really use this concept of can you activate the verb by way of the thematic roles. But I think, as we talked about earlier, repetition is important, or at least production of the verb is important in the treatment. But with this participant, I was still using the old protocol, so she didn't really retrieve the verb in treatment. She was just retrieving the nouns. I think that gets important. Yeah.
When they made the semantic errors, had they uttered them already before, or were they had they generated them before, so they were...
You mean...
You asked about perseveration, so they weren't intrusions that they'd already uttered, or... Pilot comes from nowhere. It was truly a semantic error.
Actually, a lot of times people, more than one person actually said pilot for the chauffeur. So it was, yeah, and it... I think so, because sometimes it was consistent, and that's where you get frustrated, because you're like, but you stuck with pilot now, and I can't unstick that because it's a probe. But yeah, they seemed very meaningful about it. Yeah, no, it wasn't a lot of groping for different things, but we would take their best production. But again, these folks were pretty impaired, so we pretty much got 3 words. If we got 3 words. No, they seemed really meaningful when they made those semantic errors. And it had to be, or like within that category, it had to be a profession that did that thing. It couldn't be an association. It had to be clearly a semantic member of that category to get that half credit. So we were pretty careful about that. Okay, so here's, so we did a longer baseline, so now we have the 30 words I told you about. Here's the trained items. Now the prediction was that they're not going to improve as much, and they're not going to improve as quickly, for sure. That was, the prediction. Other than that prediction, I had no idea what would happen, to be honest. So here's the trained items. So she gets up to about 25, so she's getting 25 out of the 30 words at the end, which is really good. And this is a C statistic here that looks at sort of the slope over time. And so I used that as the generalization measure instead of that 40 percentage points. And then these actually, I don't have it marked on here because there's a lot going on, but this is 1 month and 5 months. So these are really maintenance because I didn't do the 3 right after treatment, which I did for participant 2. But to calculate this effect size, which looks at sort of the magnitude of change from baseline to post-test, I used them since they were stable. So they're actually maintenance points, just so you know. Then here's the untrained, also showed improvement, and then with nice maintenance as well, in the same adjective control task that didn't improve. And here's an example, driving cars, and then chauffeur driving limousine was her post, or one of the later probes. And just some salience, new drive. She drove a go-kart around, and she loved a jet ski. That was a really big deal. Her dad drove a fishing boat. She had a friend who sewed a Halloween costume, which was her favorite holiday. She liked to talk about that. And she had a lot of wide interest. And when she said archaeologist in treatment, I about fell off my chair because I would not have expected that from her. And again, that's what that was hers that she generated, that an archaeologist examines bones. And then participant was really pre-treatment. She had very little intelligible output, and I really didn't know how she would do on this, and she exceeded my expectations. So here's her trained, and then these are after treatment. So this is 1 week, 2 week, 3 weeks after treatment, and then this is a month later. After this, she enrolled in another study that would have prohibited me to continue maintenance. I don't have anything past 1 month. Here's the untrained for her as well. So here's treatment, and this is untrained. So look at what happens after treatment ends, and then the maintenance and the untrained. It's just so interesting. And then here's the adjective control task. Here's an example. The teacher is erasing the board. Pre-treatment 2, and then a teacher erase board. And then some examples of a friend throwing a hat into the street. There was some party she wanted to talk about. For erase, she had a friend who was a sound man who erased an audio tape, and he got fired, and there was a lot going on with that one. And then also dad drive boat. I mean, we're in Florida. And so water, morning fun. Okay, so that's participant 2. And then their pre-post data, here's their WOB scores, went up nicely, 10-12%. Now, this data is really interesting because we've got error analysis and everything about it, and I won't bore you with it unless you want to know. But here's the BNT, and this is also why I like the object and action naming battery. So in participant 1, it looks like there's no improvement, but if you look at the object and action naming battery, you see there's about 20 percentage point improvement on her noun naming. But she didn't improve on the verbs, and she didn't improve on sentence production, which I was surprised about because she was doing fantastic in treatment. Her mom was telling me she was talking a lot more. She was clearly putting sentences together more, but it just didn't translate to the sentences. And I think I have a slide about this, and we went back and looked, and her verbs just didn't improve in relation to her nouns. So you can see that in the single word naming. We also saw it in the probes. More nouns improved than verbs, although verbs had to improve for her to get that ultimate score. And same thing on here. She did improve in her verb production, and they were mostly semantic errors that she made, but it didn't budge here. So this is why I mentioned to you that there was no retrieval of the verb in treatment. I think it might have an impact because participant 2, I had sort of already figured this out by then. Now I have participant 2, and when she went through to read the pairs, we had her put the verb in with it. So there was an extra repetition, but she said the verb at least as much as she said the nouns. Although they say the nouns more because that's what the whole therapy is retrieving nouns when you think about it. So anyway, she improved on the BNT. She improved a lot on the object and action naming battery, like 30-some percentage points. Her verbs improved, and she improved 22 percentage points on these sentences, and at the beginning I would have never predicted that. And also her written naming also improved a little bit on nouns, but more so on the verbs. And I think her ability to improve on verbs really helped her overall sentence production improve. The way we integrated her writing into treatment was she just was not going to be able to produce anything to begin with spontaneously. But she always knew what she wanted to say. There was never a lack of I don't know what to produce. So we didn't want to go, okay, well, this is unintelligible, let me give you cards to choose from. That really defeats the whole purpose of her activating her own, memories and semantic system and all of that. So we allowed her to write it, and but then after she wrote it, she had to read it and say it. And if she couldn't, the clinician would say it, and then she would repeat it. And we tried to fade that out. So we absolutely allowed her, and I have a bilingual guy doing this now with a similar kind of situation, and we let him do the same thing only when he really, really gets stuck. Because they're clear on what they want to say, and you're really not sure, and you don't want to move on. So that we did allow her to do that during treatment.
So her written language was better?
Yeah, absolutely. Yeah, and she was using that a lot functionally, but she was in a wheelchair, and it wasn't always convenient because she didn't have like a tray or anything, and her notebook was always in the back, and so inevitably someone would ask her something, she couldn't write it, so somebody would talk for her. So this really kind of changed her paradigm to try, and she was talking a lot more. She was talking to students in the elevators, and I mean, she really was communicating a lot more after this. I mean, still she was impaired, but there was a huge change. So this is a lot. I won't go on about this. I had like graphs, but I thought not everyone's so interested in verbs. But one of the common errors in the probes was, as I mentioned, that use of instrument in place of the verb. So it wasn't a verb and the instrument. It was truly using it in place of, and it's a really interesting error. But it's also almost one to unstick, because I really feel like they've told you the verb. So there's not a self-correction, I think, once they get there. So, the probes sometimes aren't the best thing because they've decided on a response, and even if maybe there is the potential for them to improve, they don't always realize that what they're doing isn't correct. But as I mentioned, P2 showed more improvement overall. But before treatment, on nouns, participant 1 mostly had semantic errors, and with some no response, but then there was no response afterwards. They were almost all semantic errors. On the verbs, she was primarily I don't know. So to begin with, her retrieval of verbs was already more impaired than nouns, because at least she was close on nouns. Afterwards, though, she was mostly semantic, but she did have noun and verb responses when she improved. So she was still relying on the noun sometimes, but it was semantically related.
And the noun's usually the instrument or the object?
Yeah, usually, but not always, because not all of the verbs had that. But it was clearly like a semantic, it was semantically related. Sometimes yes, sometimes no. We had, we had another category for unrelated, which sometimes is something else depicted. The object and action naming battery for the not completely, but does a pretty good job of not putting a lot of extraneous stuff in the pictures, but not always. And then before treatment, participant 2 really was primarily jargon and unintelligible, and I don't know. And then after, she was almost exclusively jargon. So in other words, she didn't say I don't know, I don't think, ever. But she went to jargon, but she had a real increase in getting like more than half of the word correct. But then on her verbs, she was primarily I don't know and unintelligible, so she didn't even try, so there was no jargon. But or she tried and it was unintelligible. But the jargon came up afterwards with an increase on these 50% things. With her, it was almost like there was this activation threshold. Like it was either going to be jargon or it was going to be pretty much the response. There was just like nothing in between on her spoken. On her writing, though, before treatment, her errors were primarily semantic, with more noun semantic errors in the verbs. Again, using nouns instead of verbs, but they were semantically related. And then post-treatment, they were mostly greater than 50% of the graphemes were correct, with more noun semantic errors for verbs. So in other words, she used more nouns that were semantically related, but she also is, improved in errors. So she had semantic errors in writing, but not in spoken. So there's an evolution of errors that got them closer to the target. So then basically, we've already reviewed for the moderate. For the more severe folks, there was generalization. On the probes, on the noun naming, 20 and 32% improvement. And then only participant 2 improved on the verbs and sentence production. And we did collect the connected speech, and I just need to look at that. It looked like some increase in some lexical retrieval, but it's really not. I don't think it can be appreciable. And then I've alluded to this. There was improvement, really, I think, in all 6 participants. These are just some comments. There was more phone use. Participant 1 in the first study especially started using the phone more, talking to his son more, actually starting to go where he used to work and hang out and talk with his friends. Improved comprehension, I would say everybody reported, and I did a modified version of this recently with someone who was more mild and able to explain to me that really coherently that when there's a lot of people around, he could understand better, he could really follow the conversation, and he couldn't before. And he also said, it's the question my students always ask on the first day of my aphasia class, is do they know what they want to say? Are the words in there? You know, that's what they always want to know. And he actually told me that he didn't feel like a lot of the words were available to him. They just weren't there. He was able to articulate that. I didn't ask him, but he wanted to tell me about how he felt the treatment helped. And I thought that was really interesting. And he said, with the treatment, the words became available to him. So I thought that was a really neat way to say it. There was an increase of social involvement. The musician actually went and she performed again. She had to have the music and stuff in front of her. I don't remember what she did to modify, but she went back. And they were just able to do some more things. But there's more data that really, and more investigation into functional improvement that needs to be done. So I could stop here, or because I know you like to have a discussion, or I can tell you how I modified it for someone with more mild aphasia. I don't know what you guys would like. It's only a couple slides and there's no data. It's just this is what I did.
Well, it's 5, right? Am I right?
You said it was 90 minutes, right?
It's, yeah, so 5 is
okay.
usually, right, we started a little
Okay.
So we're close to being there. I want to make sure that people get a chance to ask questions before.
Yeah, I think that would be better.
I just wanted to sort of sound you out about some of your thoughts.
Okay.
On this. So, Lisa, talk more about what you think. I feel I'm going to be like one of your students. What's really going on in their heads? I mean, what is the therapy doing? Is it establishing connections in a semantic network that are not there, are vague, are not being selectively activated? I mean, do you have any feel for that? And I guess I'm thinking along the lines that probably Nadine was when you asked about semantic errors, because there's a sense in which, you know, if you take your the slide about the interconnectedness of these things through event structures, that you would think that a technique like this carried the risk of really inducing semantic errors, interference, something like that, essentially, by activate, if it were
like hyperactivating it,
exactly, right, without you know real discrimination. So I'm sort of amazed that it seems to get at just kind of the right degree of reactivation. And do you have any thoughts about that?
I don't think it's right on for sure. I think that's part of what was going on with those first participants, with the untrained items doing better. Those untrained items seemed to have the perfect degree of activation. The trained items didn't. In other words, there wasn't as much difficulty, or there wasn't as many semantic errors. But in the trained items, there were. So it's almost like they would see, you know, measure, whatever, and they'd worked on it. They'd come up with all these pairs of words, and they see it, and there's just boing. There's all this activation, and now they have to, you know, get the one that's just right. And I do think that there was possibly some interference that the probes kind of picked up.
That afterwards, after a month, right? You know, you saw that subside, didn't you? I mean, it looked as though you saw evidence of learning there, minus the interference.
Yeah, and that's been my.
You've seen that, Nadine and Ruth have seen that a lot.
Okay.
In the short term,
But I think I'm wondering about the same thing you're wondering about, why this interference didn't happen, and I'm thinking about how we've done it, and we've done it with the multi-naming tasks. We've done it with categories of just without the verb, and so there's not the association aspect. The verbs and the association aspect seem to provide some sort of anchor to keep the activation more organized. So even though it's getting elevated, you did see the ones that were trained were a little bit less. It's not getting out of control without anything to anchor it.
But we did try to, I did want to have some variety though. So they're not going to do 3 pairs of words of all family members, or they're not going to do 3 pairs of words that are all like health professionals. So we're not going to do a doctor, a nurse, and a speech therapist. So within the treatment, and this is just, yeah, so we tried to have different examples. Also, because I was kind of cognizant of this, it's sort of intuitive, you kind of know this could happen. Also, in the items, they were random in the order, but I would be careful not to do 2 that could potentially, like bake and measure. I wouldn't do one right after the other, because you could measure within baking. So I would try to maybe do those on 2 separate days, and not to have too many of the same people in the different, you know, situations. So I did want always to be variety, and they didn't use the same pairs all the time. We would try to mix it up so that it wasn't, I wanted to get I didn't want this where there was always the same pair every time. So predictably, when they saw this verb, these were the 3 pairs we were going to come up with. Even if it meant, you know, changing one thing. Oh, you said that last week. Let's come up with another thing that you could measure, or whatever it is. So maybe by keeping enough variety that, you know, that helped, so that there wasn't any specific items that got super activated. But I do think it was somewhat of an issue, but not in a major detrimental way. But it could be, I think, you know, if it was maybe too intense, and maybe that's why just the twice a week is fine. I wouldn't do this every day, you know, like 5 days, you know, in a row. I mean, I think they almost need a break to let things sort of settle, because it's really intense, especially for the more impaired folks. It's a lot of work.
I think the other thing, one of the things that I really like about it is just the richness of how much set switching has to go on. There's a lot of attentional components where you're moving from retrieving words to answering WH questions to trying to retrieve whole sentences. And that, to me, also, I think accounts for a lot of maybe why you didn't see as much interference or as much separation as you thought you might.
That's a good point.
I had a question.
Yeah.
So I heard kind of 2 kinds of factors mentioned in your talk that seem kind of opposite to me. One is, so the idea is verbs help in this way because they have a broad semantic network, right? But you also talked about specificity. You wanted to pick more specific verbs. They kind of, I mean, so was there a reason why you think more general verb couldn't have worked better? Because it can connect to a wider variety of nouns, correct?
Well, it doesn't, there's not, well, there's two answers. One is, if you think about that typicality stuff I told you about, so if you train, let's say, make, you might be able to come up with a lot of things that you can make, but then there's not real specific people who go along with those things. So it doesn't constrain you in a way as when you say bake, there's very specific people who can do it. But the concept of make is within baking. So, in other words, I didn't want to use these general, what I almost think of as like superordinate verbs. Make is like a superordinate verb, right? Or go. There's a lot of ways that you can do those things. But there's no one specific person who does it, and there's just the possibilities are almost too broad, and participants would, I think, almost be overwhelmed as to what to do. So if you think of the atypicality stuff, they trained, ostrich or emu to get improvement to cardinal. So you start with the one that's a little maybe more complex or a little more rich, but it consumes or has as part of it the more typical. So when you talk about bake and fry, you're also talking about make. Do you see what I mean? So that was kind of the thinking behind it. So you're you're hopefully strengthening that whole concept of different ways that you can make things. But if you just do make, I don't think you'd see improvement to the more specific items.
So you were working on some kind of so there's some kind of middle sweet spot. You think you could get too specific?
I think you could get too specific. I mean, it has to be familiar to people. It has to have familiarity, and there's something relevant about it. So like the surveyor measuring land, I know is a really kind of remote kind of thing. But if they got stuck on a couple, we would sometimes throw that in there, and it would be a more atypical example of measuring. So you can just sort of mix it up as you do it. But and plus, there's not enough of those general words. There's really not a lot of them when you start generating them. So this gives you more opportunities.
So I was wondering if you're also interested in, so it seems like part of what you're training is this problem of you have a scene and you have to perceive the major players and figure out how they're related.
Mm-hmm.
So there's a lot of what's important for the structure, basic structure of language is mapping from entities to thematic roles.
Mm-hmm.
So I wondered how much of that is critical. So if you, because you measure transfer from these structures where the verb really is the core, but
Mm-hmm.
I wonder, like if you trained them on intransitive, would that transfer to maybe building but in terms of the patient, like with training the concept of patient
Mm-hmm.
or agent transfer to patient or agent?
Yeah, and that's one of the things I've been thinking about. So there's a lot of great verbs out there, right, that aren't that don't fit into this category. So there's a couple ways you could look at it. If you looked at it more from a syntactic standpoint, you could argue that if you train 2-place or 3-place verbs, that they're going to more easily generalize to a 1-place verb that doesn't have a receiver, but that doesn't really have a semantic component. So you could also think about, are there 1-place verbs or verbs that don't have, like you're saying, a receiver or whatever, and how could you manipulate what you do? And the difficulty becomes in I'm finding this, so by being constrained to this kind of an outcome measure, where you just have the picture of what's going on, there's only so many ways and verbs that you can train if that's your outcome measure. But if your outcome measure starts to become bigger and it's not necessarily things that are just imageable in this way, then you could play with the different verbs. But then you have to ask yourself, to answer your question, yes, I think it would still in principle work, but then you have to ask, what is your outcome measure? Is it going to be a semantically related verb? But what if it's a 2-place verb? Now you have a complexity component, and are you going to just look at the retrieval of, which things? So it starts to get complex, but it's certainly doable. But I think in principle it would work. Absolutely. And you can also, remember, use the instrument. You can, what is used to do this. One of the guys we have now, I was looking at, he is actually using hand merged. So it's the ultimate instrument, right? So he's using hand for throw and pen for write, and there was one other one that was really unexpected. So you can also maybe use instruments as part of your treatment, or the location, so you can broaden the semantic roles that you use as kind of stimuli. Yeah, I think there's a lot of ways you could play with it.
Sounds like the only instrument that, I guess I can think of a context in which knife could be used as a verb, right? But all the other ones seem like they could be used as a verb, like tape you had, axe can be used as a verb, to be a hand.
Yeah, those can also be, absolutely.
Totally random, right?
Yeah, they're not. It's just an interesting error. So they're going, they're using, it is a verb, but it's not quite the right verb, but it is the noun in that, yeah. Oh, absolutely. I mean, it makes perfect sense. But when you see somebody say it's a strange picture I have now. It's a new study with the clown throwing a pie. Don't ask why. It's because it's bilingual. And there's too many cognates in Spanish and English. But anyway, to hear somebody say the clown, hand, the pie. I mean, it's a really, but you know where that came from. It's really interesting.
Lisa, has anybody looked at priming in aphasia in this context? Do we know whether people with aphasia, these types of patients, would underprime in a McRae type test?
Well, that's why I did it in the normal olders. Yeah. So I did it in the normal olders, and I did everything left-handed. I modified everything so that a person with aphasia could do it. So.
Priming?
Yeah, I did that priming study that I talked about with McRae. Yeah, so we replicated that, and with the youngs. Well, I'm just writing it now, and but we saw the same pattern in the older folks. It was really robust, and it was bidirectional.
Did you say that again?
Yeah.
That was a while back, and that was really
it's only 100 slides back. I think I took Myrna to heart when she said they want to talk about a lot of things, so I put a lot of things in here, and I lost track of time, so I'm really sorry I went kind of long. Ken McRae and Ferretti have done these great studies, and I've really encapsulated, you know, a lot of work in just this one little slide. But the idea is that arrest primes a typical doer and a typical receiver, and I think their tasks, one was an animacy task, so you had to decide if it was animate or inanimate, and the other one I think was naming. And so they consistently found in young adults that, you know, the typical or atypical thematic role and the verb were bidirectionally primed. So they did this over two studies. So the first time I read it, I'm like, well, what about people with aphasia? And so we went ahead and I modified it a little bit so that hopefully, you know, like it's not going to be an oral reading task, right? So we just did it to get normal data for older participants, and then the idea would be to run it in people with aphasia to see what happens. It's lexical decision, the one that I did. And you know, I'm open to if people have ideas and ways to improve it, because I don't want to run a lot of people with aphasia and not have everything sort of figured out. The stimuli works really nicely, though, that I developed, and a lot of it is shared with McRae, but I did change some things.
Is this auditory or written?
It was written. Yeah. So not any person with aphasia could do this task.
So when it went both ways with the McRae study, and did you do that also?
Yeah, we did bidirectional.
When you went to the next slide and started talking about your work, I was like, those seem very associated. And then you went to the Verb networks and you measured and you said, look at all these different directions it goes in. So how many things arrest? A policeman arrest? So the strength of the association between noun and verb. Is that related to whether?
Well, these are the examples I chose, first of all. So these look really constrained and specific, and that's partly to make the point. Also, so that's true. But McRae went through and he looked at this in terms of associativeness and did not find the effect. Yeah, so and he has that all written up. So he acknowledged that could be true and went back through and looked at all the association norms and could not find the effect with those.
So that means that if you had something with measure, like
I think I do.
Measures, you would still see it.
What I did,
both directions.
Because
there's lots of things that measure.
Yes. I did the exact same thing they did. I took some of their items, but some of them I replaced, and I think almost all of my verbs are transitive. So even though I might have only tested, you know, the agent and the verb, or the verb and the patient, in most cases a lot of them are transitive, because that's kind of where I was thinking. And I think measure actually is one of them. I think it's a carpenter and probably lumber. I mean, it just seemed typical. I don't remember. But I did do what they did, and they had this great questionnaire, and they would say, I think the wording is, how common is it for let's say, carpenter to measure something, and then there were other occupations. So I would put some that were kind of semantically related, and then some that really weren't. And I got all of these so I went back and I got normal data on it, and I chose the ones that people consistently said that it was very common for that person to do it, or for that thing to receive the action. So how common is it for someone to bake cookies, or to bake bread, or to bake then something that was less common? There was like 5 or 6 choices. So we kind of went through, and then, you know, we balanced for length and stuff like that, and that's how we developed the stimuli. So
you didn't get the association effect. So
I didn't run.
It's not related to how associated.
Well, I can't say I didn't look at it that way. I didn't go and look at all the association norms. I think my stimuli were somewhere between like 50 and 70% of McRae's, and he showed that wasn't true. So does it really? See, it doesn't seem. Maybe because I'm thinking.
It's just a constrained range. I think if you use the really general verbs, if you use make or something, you might not get them.
Yeah, well, McRae talks about it more about a generating expectancy kind of a thing. So that it's really not just semantic. You're tapping into your knowledge about what it means to bake. Right. And so it's not just that there's this high association. Bake. I mean, I've picked the most highly associated things like baking cookies, as my example. But a lot of them aren't that prototype. Like, I think one of them, I had like champion winning or something like that. I mean, that's, to me, it's not super strong like baking cookies, for example. But really, yeah, from a creative point of view, it's more of a expectancy generation thing. You're tapping into your knowledge of what it means to do these things, more than just a straight up semantic priming. Does that make sense?
Yeah, and I mean, I think, Nadine, I think you really picked up on something before, the contrast between, that's related to this, and that is the contrast between the kinds of contextual priming stuff that we have done and this kind of work is that it really is grounded in episodic knowledge. I mean, if you take this and that could really change the nature of the effect of the dynamics that you're seeing, which is really something interesting to explore, I think.
If you're just priming a group of words that are categorically related, there's nothing else.
That's right. I mean, it's kind of really purely a semantic network, but it really, one of the real benefits of this kind of priming could very well be that you're supporting lexical knowledge, semantic knowledge with episodic knowledge, and that's one of the reasons why perhaps you get, the very dramatic that you get.
Yeah, that's the goal. And that's why that questionnaire is nice, because the question is, how common is it for this to happen? They're not making semantic decisions about the words. They're tapping into how often does somebody do this thing, or is that the person that would most likely do this thing? And that's what the whole point of the treatment is to tap into what they know. So you can have experimental control and protocol across different participants, but it's possible that some of the items that they talk about are going to be different within the treatment, because we really let them sort of lead and just guide them as we go. So yeah, that was on, I think, slide 90. That's really what we're trying to do, is tap into that episodic kind of stuff. And actually, somebody at UCF I was talking to started doing this. I just found out with a dementia group. And she's put them into pairs, and they do this. She wanted to do something really generative, and she's put them into pairs, and they come up. I don't know exactly how she did it. I emailed her, but I haven't heard back yet. And she said they've done for an entire semester, and they really like it, and they're really involved. So it's another way for them to access sort of kind of memory stuff, but also have a language task. So we'll see how that goes.
That's great. I mean, we're going to let folks go.
Thank you. I'm sorry it went so long.
No, this is wonderful, and thank you so much for preparing all
this
wonderful.
Sure.